Good morning and welcome to Trusted Transitions, where we help seniors navigate their home transition journey. Today's guests include Jane Goessl, the local marketing director at Tudor Oaks Senior Community in Muskego, Melinda Stewart with Smart Moves, Michelle Fitzgerald with Horizons Law Group, and John Whalen with Cornerstone Development. My wife Tracy and I produce this program each week as a resource to the senior community in southeastern Wisconsin. A little bit about us. We're a husband and wife real estate team. I'm a licensed realtor with an SRES accreditation, which stands for Seniors Real Estate Specialist. Basically means I've completed education to better address seniors' unique needs when it comes time to sell their current home and transition to a new home or senior community. If you're thinking about selling your home this year, it's really a good idea to reach out to a realtor early, well in advance of the month you plan to make your move. When you call us, Mike and Tracy, we'll provide you with a complimentary market analysis so you know how much you'll likely receive on the sale of your home. We'll also make recommendations on repairs to ensure you get top dollar, and we can help you find your next home or senior community. You can reach us at 262-366-4600 or online at homefinderwisconsin.com. Again, that's 262-366-4600 or online at homefinderwisconsin.com. Now, let's meet our first guest, Jane Goessl, the local marketing director at Tudor Oaks Senior Community in Muskego. Good morning, Jane.
Good morning.
Morning.
Hey, good morning. So, what are we going to talk about today?
Well, good morning, everyone. This is Jane Goessl, Marketing Director at Tudor Oaks Senior Living, located on McShane Drive in Muskego. We are a nonprofit, faith-based community offering a full continuum of care, which means we have independent living, assisted living, memory and enhanced care, and our skilled nursing and rehab. For information, you can reach us at 414-529-0100 or visit us online at www.tudoroaks.net. Today, I'd like to welcome our guest in the studio, Zachary Mohn. He is our healthcare administrator. Hi, Zach.
Hello. Thank you, everyone. Thank you for allowing me to take a few minutes of your time here today. I really just want to walk through how short-term rehab here at Tudor Oaks supports not only our residents, but also the hospital discharge planners and the families. And we're going to do that with a few questions Jane's going to throw my way here.
All righty. So basically, I wanted to start with, who is an ideal candidate for short-term rehab?
Okay. So the ideal candidate, someone who's medically stable, but just not quite ready, not quite safe enough to return home independently. This can include anyone recovering from a joint replacement, cardiac event, stroke, fall, or just general deconditioning. Someone may be a little weak in the hospital bed after a few days, just need a little bit more of a little more work. The idea is to just bridge that gap between hospital and going home safely. And Tudor Oaks is a great place to do it.
So how does like a place like Tudor Oaks support, safe and timely discharges from the hospital?
So we're really big on prioritizing responsiveness and coordination. We have a really great team here in our admissions team. They have a wide network with different hospitals. They have a good rapport with them, and they use that to streamline their admissions process. They do it by ensuring patients can transition quickly without really any unnecessary delays. They do it consistently so that everyone from the resident or patient to the hospital staff, to the hospital discharger, to their family members, everyone knows exactly what to expect. We're all on the same page.
So how do you help reduce readmissions for hospitalization?
So obviously we don't want anyone going back to the hospital after they come here. So we really promote a strong clinical oversight and promote proactive care. We offer around the clock 24/7 skilled nursing support. We take care of their management of their medication, their administration of their medication. And we have ongoing monitoring throughout the night and throughout the day. That's just from the nursing side. So from therapy, we also have a very consistent and goal-oriented plan from therapy, which helps residents regain their strength and their functionality. Rather than just rushing through the process, they really take a methodical approach in recovering them.
That sounds awesome. So what does therapy look like, and how, what's the outcome? Is it outcome focused?
Yes, outcome focused. That's great. So much like hospitals, we're very much patient-centered care, or here it's resident-centered care. So each resident has their own individualized therapy plan, and it's based around them, their diagnosis, their level of functionality, and what their ultimate discharge goal is. So therapy focuses on just more practical, real-life activities, like how they transfer from the bed to a standing position, or how they move, if they use a walker or a cane, or if they walk independently. Things like daily living tasks like brushing their teeth, getting dressed, making dinner, just anything that would transfer over to their home life. We also will track and communicate their progress on a regular basis, from therapy to nursing to social workers, discharge planning coordinators. And sometimes it may even require therapy going the extra step and doing a home assessment. So they'll take the resident with them to the resident's home to kind of look at what environment they're returning to. So if Mrs. Smith, recovering from a hip fracture, has 15 steps from their first floor of their home to the second floor of the home, is that something we can actually get her to do, or is there some kind of assistive device we need to send her along home with?
That is wonderful information. So how do you involve the families in that process?
So family, that is crucial to the recovery. So they're coming here not knowing anybody, not knowing the other residents, not knowing the staff. So having family involved and someone who's known them their whole life to give that extra moral support is very crucial. The way we get them involved is within the first few days, we have a care conference. That's kind of headed by our social worker. She gets everyone involved, from therapy, of course, to nursing, to, depending on the situation, dietary manager, activities managers, anyone who's involved in the recovery process. And they discuss the process, their progress, excuse me. They discuss their progress. They discuss how long we think they may have to stay here till they get to that recovery stage, and then what the discharge planning will look like once they do reach that stage. And then with a family who may feel uncertain in how they're going to help their loved one back at home, we do provide guidance and education to kind of give them that extra support when they do go home.
So what makes the environment at Tudor Oaks so beneficial for their recovery?
Well, much like family support, the environment is also a huge factor in having a positive impact on their recovery. We do it by offering a setting that is both clinically supportive and comfortable. So it's designed with safety in mind. We don't want to rush anyone through their rehab. A big thing at the forefront of everyone's mind is to reduce any risk of falling or backsliding. So they always want to keep moving forward with their progress, but we do it in a very welcoming and community-oriented way. So it doesn't feel like you're working out. It just feels like you're working with people that care about you. You're just going slow and very, like I said, methodical in their approach. The balance with the working out and the comfortable environment, it helps keep the residents motivated and engaged to keep going and have that positive impact on their outcome.
So how do you ensure a smooth transition back home then?
The discharge planning happens as soon as they get admitted into the facility. So our admissions team will work with our discharge planner as soon as they get here to coordinate a care conference, like we spoke about before, to talk with anyone who has any involvement in the care and the discharge process. That's therapy, nursing. It could be the dietitian, the doctor as well. And it's done to ensure the residents have a fully prepared, both physically and on the practical level, to enter into that next step going home. We do offer home safety recommendations, like we talked about before, with home assessments. We'll give them a continued therapy plan and then coordinate any other kind of services they may need once they leave our facility. It's really intended to prevent any kind of gaps in the care from here to home. We don't want them putting all the work here, getting home, and then kind of, falling backwards. So we want to make sure that their therapy is continued even after they're done working with us.
Well, thank you. That is a lot of great information.
Absolutely. If I could just have one closing statement here, just to kind of recap everything. So for discharge planners, Tudor Oaks here is just a very reliable partner in ensuring that we have a safe and efficient transition. For families, we focus on providing peace of mind, knowing that their loved ones are receiving the best care possible, the therapy, and any kind of other support they may need to recover fully before they do return home. At the end of the day, it's really just all about better outcomes, safer discharges, and just having that confidence during the recovery process.
Well, thank you again for joining us today. Again, my name is Jane Goessl, Marketing Director at Tudor Oaks. I was here with Zachary. He is our nursing home administrator. So for information, availability, or just a time to schedule a tour, please reach out to us at Tudor Oaks. The phone number is 414-529-0100. Or again, you can also visit us online at www.tudoroaks.net. And thank you, and just have a wonderful weekend, everyone.
Thank you, Jane. Thank you, Zachary. We're going to take a short break, and we'll be back in just a minute with Melinda Stewart at Smart Moves.